This morning, Alabama lawmakers introduced a bill that is said to address the growing need for physicians throughout the state. Alabama is short about 3,000 doctors. That's according to the state's medical association. Medical officials in North Alabama believe the new bill could positively impact these shortages throughout Alabama. News 19's Daryl Burke joins us now live in Huntsville with what health experts shared with him about physician shortages and that proposed law. Daryl.
Christine, Alabama State Senator April Weaver introduced the bill because this has been a growing issue here in North Alabama and across the states. Alabama is said to be short 3,000 doctors, according to the state's medical association.
There's a big need for more physicians in the state of Alabama, and that goes for primary care physicians as well as specialists.
That need is working to be addressed by the Physician Workforce Act, which will introduce solutions to filling the gap of licensed medical doctors in Alabama. This map illustrates a significant need for physicians across the state, with the green area representing a majority of the shortages. Dr. Roger Smolligan says part of the bill that would reduce postgraduate training for international medical students would be significant in filling those positions in a timely fashion.
This would allow them to get their license early enough to where they could enter the workforce on their days off. They could be working in emergency rooms or urgent cares if they can get that license a year earlier.
Dr. Smolligan, along with his staff at the UAB Huntsville Regional Medical Center, say keeping doctors in the state is key to fulfilling that need, especially in the rural areas.
Almost 80 to 90% of our medical students are going to be from the state of Alabama. If we can find sharp young people from rural Alabama, many of these young people are more likely to be interested in and willing to go back and practice in their hometown area.
Without altering the high standard for care, the bill would also enable those who have yet to match with the residency program to offer care under certain circumstances.
Give them an opportunity to come and work alongside and almost be continuing their residency, but be able to see patients, take care of patients, but have an experienced physician, licensed physician in the state of Alabama, observing their work.
Both the House and the Senate versions of this bill passed unanimously earlier today. The bill will next be voted on by each chamber. Reporting live in Huntsville, Daryl Burke, News 19.